Dr. Bob here, and I want to continue with working with you guys to understand chronic disease. I'm still covering diseases of the cardiovascular system at this time, and we're going to talk about a diagnosis, often abbreviated CHF, or congestive heart failure. Before we dig too deep, I want to review why you need to learn about chronic disease. Well, first of all, someday you may be involved in a loved one who gets that diagnosis in an ER setting, and just understanding the physiology of it a little better will be helpful. But if you refer back to my definition of discipline and my discussion on motivation, I think if you understand the malady, it might provide motivation to discipline yourself to do the things in your life that can help you to avoid these endpoints. And I fully believe that for most of us, they're avoidable, or at the very least, prolongable, so that you can have a higher quality of life and a better health span, as well as probably a longer life. So back to CHF, congestive heart failure. Now, before I dig too deep into talking about the disease itself, we probably need to review basic cardiology and the vascular system quickly. So if you look at a diagram of blood flow through the heart, we see that typically we have a 4-chambered heart. Pretty much all mammals and warm-blooded animals have a 4-chambered heart. I think some of the bigger reptiles like crocodiles also do. So we have a right side and a left side to our heart, and the right atrium, it receives blood, deoxygenated blood, that's been used by the body for metabolic processes, where it is then pumped from the right atrium through a valve, the tricuspid valve, into the right ventricle, which is a muscular part of the organ that has enough power to pump that blood out the pulmonary arteries to the lungs. Now, the pulmonary arteries are the one set of arteries in the body that carry deoxygenated blood. Normally, we think of arterial blood as oxygenated and venous blood as deoxygenated. But actually, more precisely, arterial blood is carried away from the heart and venous blood is carried towards the heart. And it depends on which side of the circulation, whether it's oxygenated or not. So the blood goes through the lung bed where it's oxygenated, and then it's returned to the left atrium of the heart, where it travels through the mitral valve into the left ventricle, which is the big muscular part of the heart responsible for pumping all that blood into your body, all the various vital organs, your brain. The heart itself has to receive a blood supply through the coronary arteries. They're the first things that get blood from the heart. They come right off at the beginning of the aorta, which is the largest artery in the body. This oxygenated blood is carried to the tissues, where it provides oxygen and nutrients for cellular metabolism. Now, what we see when congestive heart failure occurs is that the pump is failing. Now, congestive heart failure can occur on both sides of the heart. You can have right-sided heart failure, left-sided heart failure, both. And there's various causes. I'll discuss a few of them. We'll start on the right side and discuss right-sided heart failure first. So, right-sided heart failure typically presents with symptoms of fluid accumulation in the body. Remember, the right side of the heart drains the body. Now, if pressures start to build up on that side downstream of the heart, which happens if the pump is failing, fluid starts to leak into the tissues. And the tissues that are most commonly affected are the ones that are the lowest with regards to gravity, the feet and legs. So we see what we call a condition of edema in the lower extremities frequently as a sign of right-sided heart failure. Now, this can be a very debilitating thing. I have seen people who literally weep fluid from open sores in their legs from right-sided heart failure. This goes into this vicious cycle where, because of the openings in the skin and the stagnant flow, immune function's really poor in these tissues. Bacteria get in and they get a recurrent condition called cellulitis. It's terrible. They have to be hospitalized on IV antibiotics with their feet elevated. It keeps recurring, and it's a really bad place to end up. How might right-sided heart failure occur? Well, the pump, the right ventricle, the pump on that side is pumping blood through the lungs. The lungs generally are a pretty low pressure system, but that can increase over time. And conditions that can do this are things like sleep apnea. Why? Because when you have sleep apnea, you have poor oxygenation of your lungs. It turns out the body's pretty smart, and it doesn't make sense to push blood through an area of lung that is deoxygenated. So for example, if you got pneumonia and part of your lung filled up with pus, there would be no ventilation, no oxygen getting to the lung. So the body's smart, it constricts the blood vessels so not much blood goes through that portion of lung. And then you shunt the blood flow to the aerated portions of lung so that you don't have deoxygenated blood getting over to the left side. Well, guess what happens in sleep apnea? The entire lung is deoxygenated. And so for periods of time during the night, you have episodes of what's called pulmonary hypertension, high blood pressure on the lung side. And that means that the right ventricle has to work against an excessive load, and eventually it starts to become stiff and fail. Other conditions that cause low oxygenation, you guessed it, COPD, asthma, smoking. There's certainly direct insults to the lung that can cause this kind of process as well. Primarily, we see right-sided heart failure associated with lung or pulmonary dysfunction. Obviously, heart failure can be related to damage to the heart itself, so either side can be compromised from things like previous heart attacks. So if you had a heart attack that affected the right side of the heart, you might get heart failure from that. Now, the left side. What do you think the big cause of left-sided heart failure is? Well, again, if you exclude damage to the heart from things like heart attack or myocarditis like we saw with COVID, and you just went with kind of the chronic issue that causes it, it's high blood pressure. It's one of the reasons why it's really important to control your blood pressure if it's excessively high. So the blood pressure on the systemic or body side, which we can measure with a blood pressure cuff on our arm, for example, if that's chronically elevated, the left ventricle is pumping against that heavy pressure, and it starts to wear out and thicken and become less pliable, so it can't fill as well, it doesn't pump as well, and we start to have a decrease in cardiac output. And we see things like easy fatigue, so you can't exercise well, and we see the backflow problems similar in the legs, but this time we're receiving the blood from the lungs, so where do you think the fluid accumulates? In the lungs. So frequently when we think of congestive heart failure, we're talking about left-sided heart failure, and we think of people who have trouble breathing and their lungs fill up with fluid. And again, this can be caused by direct damage to the heart or chronic overuse against a high-pressure system. Obviously, that's a debilitating thing as well. Now, we do have medications that can help with this, and congestive heart failure episodes can wax and wane, and people come into the ER gasping for air, and frequently we can rescue them from that with some pharmacology and get some of the fluid off. But once that process sets in, things are starting to look pretty grim. So, we've discussed now heart failure, and conceptually you understand it's a debilitating thing where the pump is not working properly. You're predisposed to it from other disease processes, frequently lifestyle related, and we want to avoid having these diagnoses. Thanks for understanding that as the brown bear to avoid.